A geometric broken line closure is utilized to break up a linear scar into irregular shapes so that they are better camouflaged, in that the eye has a great deal of difficulty following these broken lines and therefore makes the scar less perceptible or better camouflaged. The geometric broken line closure is really designed so that each side is a mirror image of the opposite side. Because of the toughness of the pig skin, the geometric shapes here are accentuated, certainly larger than what we would perform on a human in scar revision technique. Here we can see the undermining, and using either a 15 blade or the scissors. Note the double hook, and third instrument, as it were, is the middle finger of the surgeon's left hand, while the scissors are dissecting using the tip upward technique so as not to cut any of the important deep structures. Once these tissues are well mobilized, then the surgeon will try to close the tissue by pushing the tissue together. Deep sutures can be utilized if necessary. There he's trying to close the tissues, and you can see we're now placing the sutures from apex, from peak to valley, and the tissues being well undermined allows the closure to occur with minimal tension. You want to close it with minimal tension to prevent widening of the scar postoperatively. And of course you want the edges to be everted. So a technique is utilized to make sure that these edges are everted. Now you can see how nicely, just with one suture placed, the wound is coming together. And that is because of the wide undermining. Again, the sutures are placed peak to valley, apex of the peak to the depth of the valley, and you can see how nicely this begins to close this pig's foot. The remainder of the sutures are placed peaks to valleys, and then according to the principles of halving. Here's a closer view showing the introduction of the simple sutures to close the geometric broken line closure as a technique or method of scar revision. Here we can see in this particular example the corner suture is being placed so that it does not interfere with the blood supply of one limb of the flap. There the corner stitch is put into position. It now comes out through the skin on the opposite side so that the closure can be made without interfering with the blood supply to the delicate tip where the incision had been previously placed. So there's an example of a corner stitch. And again, that is not necessary at every site. It can be used when you think there's a concern about the blood supply to the tip of the flap. That shows the conclusion of the close